all coming together to protect the public. That's what we're here for. St. Francis has been in this community for 122 years. We've never abandoned this community, and we're certainly not going to start today. So with that, I will pass it on to Dr. Danielle Ibrahim, our Chief Quality Officer for Trinity Health of New England. Danielle.
Thank you, John. Good morning, Mr. Governor and the team. Good morning, the leadership here, Dr. Rodas and the leadership team. Good morning, everyone. I'm here representing our regional leadership on behalf of Dr. Reggie Eady, Dr. Hussein, and also Lisa Zapatka and the entire regional team. I want to say that at a time when COVID-19 is spreading globally and also here in the United States, our communities, our patients are looking at our clinicians, our providers are looking at our hospital system, are looking at our state officials to really lead them and give them reassurance. And I want to say we're ready. At Trinity Health of New England, we have the advantage of being part of a regional health system, 5 hospital system here in the New England area, 4 hospital system in Connecticut, and 1 across the border in Massachusetts. But more importantly, we are also part of a national health system, Trinity Health. We have a great advantage of unifying our preparedness, our approach. We are following the CDC recommendations, being prepared. What that means, we're focusing on 4 areas. 1, we're ensuring that our clinicians have the protocol, processes, and the resources they need to be able to timely identify patients with risk for COVID-19, isolate them properly. Our staff are properly trained and rehearsed, and they're professional in their ability to approach and care for those patients who are really here in our hospital. The second focus is on being really good stewards of our resources. These include our personal protective equipment, our pharmaceuticals, and medical equipments that we need. The third focus is we're looking at our HR processes, in entertaining scenarios like sickness among our colleagues, working from home, and perhaps social distancing. And then the last focus is really as important. We have a unified messaging and communication continuously that's community and patient-facing, and also with our colleague. Our goal in all of this, and I want to say this and share this really clearly with you. At the time when there's a lot of uncertainty and fear in the community from something that is unknown and uncertain, we have a great way here in the hospital of using science to discern through the facts and instill calm at the time when perhaps there are a lot of exaggeration or not real reflection of what's going on. We have the ability to change the course of COVID-19 in our state. That is really good news, and that's true. So if we do everything right and collectively, like John said, pull together as a community, partnering with the state and our health officials, we will be able to fight back. We will be able to derail that virus. And lastly, I just want to mention 2 things. On the innovation side, we're also exploring two areas. One, it is critical for us to be able to do COVID-19 virus testing timely. So right now we believe our capacity in the state is probably limited. We are exploring ways with the state and DPH to expand that. That's going to be a game changer. The second one is also we're looking at ways, how can we, in a safe way, keep our patients home where they need not really come and show up in the ED to add extra burden to our hospitals or the doctor's offices. One of the ways we're exploring is the concept of triage centers. And so I'm going to stop here and then pass it on to the governor. Thank you.
Thank you, Dr. Ibrahim and Dr. Rodas and everybody here from St. Francis and everybody up there from St. Francis. Thank you for what you do. Thank you what you do for the patients. Thank you what you're doing for public health. But this is a time where some people are on edge. And one of the things we're trying to remind people every day is hope for the best and prepare for the worst. You know, earlier this week, we had Jerome Adams, the Surgeon General from the federal government, come and spend a couple of days with us, making sure that we got all the support we needed at the state level, and now working in close coordination with our hospitals and local health clinics to make sure that we're ready for what could be coming along, and making sure we talk with a unified message so people knew what to prepare for. One of the things we're able to do earlier this week is open up the state lab for testing. as Dr. Abraham said, it's so important we have faster, more reliable testing going forward as quickly as we can. We have done dozens of tests to date, and more are coming in. So far, no sign of infection yet at this state, but let's face it, we're surrounded by states that do have isolated examples of this, and we ought to be prepared for what we've got going forward. I think most important today, working with St. Francis, working with our other hospitals, working with Quest, working with LabCorp, private entities, is we're going to expand our testing capability so that we can really prioritize people that need to be tested. Folks coming from some of those Tier 2 countries where the epidemic has spread most robustly. Really focused on those that might be most at risk, maybe going towards the nursing homes and retirement centers, just so we can be very careful in terms of what we can do in terms of prevention. And testing is really important. Look, as you know, COVID-19 is receding a little bit in China right now. That's a very good sign. They were able to contain the virus by having, quarantining tens of millions of people. We don't do that in this country. In fact, I'm sort of having a hard time here in the state government just getting everybody vaccinated. And but more importantly, with testing, we'll be able to tell those folks who are most at risk. We'll be able to make sure that those folks who are most at risk to themselves and spreading the virus, that they can self-quarantine, self-monitor, make sure they stay out of broad circulation. That's how we'll be able to contain this going forward. And we couldn't do it without the most amazing hospital system in the country, right here in Connecticut. And, as Dr. Rodas said, if we can't get it right here in Connecticut, who can? We're prepared. We've been preparing this for a while. We know what's happened before in other similar viruses. Probably it's going to look like a bad flu season, but hope for the best and prepare for the worst, and we're ready. Thank you, everybody.
Thank you, Governor. Is the mayor here? Yeah, we can.
Could someone elaborate on the triage center, the triage center concept? I think that was also what you were alluding to.
Yes, we were talking about the idea, the concept of triage centers, and maybe I'll pass it to Dr. Ibrahim, and Dr. Wolf can talk about actually what happens in real time right now in hospitals throughout the state, throughout the country. But the concept is to a place where people with a fever and a cough and shortness of breath can go to be screened and evaluated, and also isolated from everyone else while they're being assessed, putting a mask on so they don't infect other people around them while they're tested, assayed to see if they go from people of concern to culture them and find out if they're indeed infected. And if they are, and they're sick, of course, then they need to go into hospitals. So the point is to have locations throughout the state, as we do now in the 30 hospitals we have throughout the state, that they can be tested. But the idea is here, keeping them maybe out of the hospitals, out of the emergency departments, out more in isolated areas. So, I mean, in other countries have done this. It was done in China, it's been done in Australia, it was done in Canada. It's everything from, could be tents, it could be offices. Again, this is very preliminary, so we're just looking. We're happy to work with the rest of the state agencies and other healthcare systems to develop such a system. I think the testing, as the governor said, is really critical and essential, so you don't have to wait a long time to get a result. Anyway, so I'll let Dr. Ibrahim maybe answer some more questions, and then maybe Dr. Wolf can just talk about the process now as it's currently done, which would be the same process at any triage center. Daniel, you want to?
Yeah, sure. Well, thank you, Dr. Rodas. You did a great job in summarizing the concept. So this is not new. So in past epidemics or pandemics, including the SARS, and if you look across the globe, the idea of establishing what we call a zone. So ideally, we would like to keep our hospital, for the most part, a cold zone. What I mean by that is we would like to minimize the entry of folks who are really here coming to the hospital unless they really need to. And so you establish a zone, well, we call it now a triage center. And that's really what's happening across the globe, including China and other countries. So you establish, let's say Dr. Rose mentioned the concept of a tent. in association with a health system like Trinity Health of New England. And that's just a concept. So whereby, you can receive patients, triage, so that space will be resourced properly with experts. You're able to screen them. And then at that point, for the majority, if we do a really good job, for the majority of folks who show up will likely go home. And so, but the critical piece here is having the availability of testing and the turnaround to be really timely to do this really properly. This is a concept. It's for us in the state, it will be an innovation. This cannot be done by one hospital system. This really is an initiative that should be, in my opinion, our opinion, led by the state, pulling all our health system and partners and public health agency and community agencies together collectively to be able to do this well.
When you look at how many people are being tested in, say, South Korea, it's pretty clear that the United States is lagging behind on our capability to test at this current moment. Do we need to be rapid testing at points of entry, airports, screening people? And Governor, I know you requested more test kits from the government. What number do you believe is sufficient?
Well, the message here today is we are ramping up our testing capability dramatically. And we're able to prioritize following what the CDC says in terms of those folks that we should be testing first. Those that have severe respiratory issues that have been already directed to St. Francis and other hospitals. Those that come from those those countries that are most at risk. Seniors, especially those in the nursing facilities. So I think we're going to have the testing capability, especially working with hospitals, working with our private partners, to be able to do all that on a prioritized basis. And obviously in China, they were testing everybody at some point. I don't think that's going to be necessary, but we're adding on that capability all the time. And as regards to tents, to me, so it was a little interesting, a little risky for me to try and explain this. I'm a sociology major surrounded by doctors, but it's an airborne illness. So having people come into an interior place is a little riskier for the testing. I was sort of interested, Sue, at the lab. We change out the air every 18 times an hour within that lab just to make sure it's clear. That's one of the reasons why people are thinking about, as needed, we might do that in the tents outside.
But screening at airports, is that something that we need?
Look, it is. Obviously, we have Bradley Airport, so there's not as much international travel, mainly coming from Ireland. But we are tracking that. Most of those people, by the way, are being tested on the other side, tested before they get on the plane coming to the United States. But your report at Newark and the other major international airports, I think you're going to see more aggressive testing there. And I know Governor Murphy actually has a quarantine hotel reserved as needed near the airport just in case.
And you don't have a number for how many test kits you believe Connecticut needs?
I don't know, maybe I can ask you guys in terms of an absolute number. More is the answer to that question, more.
Governor, can you go into more detail about how you're trying to expand testing capabilities?
Yeah, I mean, we were sending everything down to CDC in Atlanta. That was taking a long time. Then, in the last week, we've been able to add on, our state lab. That allows us to turn things around much more quickly. Now, I'd like to think that over the next near term, our hospitals will be able to do more of that testing, not to mention, LabCorp and Quest. I think that would be enormous. And, those are testing companies, private companies, all over the state and all over the country. So, Sue, I think we're going to be very aggressive in terms of expanding our testing capability now.
What is the time frame for the idea of the triage center idea? Is that just something you've been discussing now, or do you have plans to have that in place within a month or weeks?
I don't know. That was your idea. Let's Josh take it.
Hi, good morning. Josh Jabal, I'm the Chief Operating Officer for the state of Connecticut and the Governor's Administration. So what's important to remember here is there's two key steps to this workflow: collecting the samples and then testing the samples. So a lot of this discussion about the kits is about testing the samples. So as the Governor mentioned, we came online with the state lab last Friday. That's our first opportunity to test samples locally. Last night, Quest and LabCorp announced that they are now rolling out commercial testing capabilities, which is a big deal because that significantly expands the national capacity for processing tests. And then, as you heard from our colleagues earlier, many of our larger hospitals in the state of Connecticut are also going through an FDA process right now to be able to do their own testing on site. So we are days away from having dramatically increased capacity to process tests. Then the bottleneck shifts to collecting the specimens from potential patients. And so that's the concept of alternative testing sites. Fever clinics is a term that you may have seen on TV in other countries. So that is keeping people who are not critically ill away from the ED, preserving our most scarce resource in our hospital system, which are the beds for the people who are critically ill, and being able to get those samples collected away from our emergency rooms. And so our major hospital systems in the state are in process, as Trinity is, of setting up alternate sample collection sites. Once we have those two things in place, then we can dramatically start to ramp up the testing volume and the data collection and the measures that come from the increased learning there.
Is there any sort of approval process or process for setting up those triage centers?
Yeah, so all of our hospitals are working very closely with our Department of Public Health on this initiative. They're in daily contact, and so that's an ongoing discussion.
Governor, what about events like St. Patrick's Day Parade?
Do you have a question? Do you have insurance coverage?
We are working with our insurance companies to make sure that cost is not a barrier to testing, and we hope to follow up on that topic with some more specifics next week.
Governor Lamont, what about St. Patrick's Day Parade, bigger events that are coming up? Do you have any concern? Are we keeping those going? I know some states have, are nervous about the Boston Marathon, for example. It's not that scale here of an event, but any concern going forward?
Look, I'm marching in the parades. It's an outside venue. If you have a cough in your sleeve. Be thoughtful about people in and around you. But I think it's going to be a good St. Patrick's Day season.
And what about, we have talked so much about study abroad trips, and now there's maybe vacation where students can go and do whatever they want. It's their priority. What would you say to them? Are you asking them of anything? Maybe you have a trip to XYZ, not through the school. How are we going to watch those students?
I'll tell you what I've told my family. Probably just do essential travel. Don't do non-essential travel right now. Certainly not to those areas of the world that are most at high risk. And I just think that's common sense.
Do hospitals have the ability with their supply chain people to get more protective infectious equipment in the event that we run out?
That's a Jim Mazel question.
Jim?
Hi, I'm Dr. James Mazo. I'm the Regional Medical Director for Occupational Health and Safety for Trinity Health New England. So, yeah, good question. So we are in active daily contact with our supply chain. All of our hospitals are at level green. We have backup reserve supplies. So currently everything is all set, nothing to worry about with that situation.
Governor, in terms of state funding, are you, was it about $7 million is coming from the plan or something like that?
I think it's about $8 billion.
I mean, what Connecticut's share? Do you have any information on that? What the state funding?
I think of the $8 billion, something like $1 billion is to be allocated to the states. So we're looking at that. We've already got a $500,000 grant we're using for data collection right now, so we can source where things may be spreading and be able to react most aggressively.
And are you discussing any kind of state allocation, additional state funding?
We're taking a look at that, Paul. We don't have to make up our mind on that right now. We're getting the federal funding. We got the grant. We're doing the data collection. Nothing is holding us back. But, we're thinking how this is going to impact our hospitals, what that's going to mean in terms of overtime, what we need in terms of additional supplies. So we're on top of that. Everybody, I want to thank you all for coming. And thanks, St. Francis. Thanks for inviting us.
Thank you all, and some of our physicians will stick around. If anybody has specific questions for them, feel free.
Sorry.